Ladies and gentlemen, thank you for standing by and welcome to HIPAA Omnibus Rule Becomes Effective September 23, 2013. What you need to know, presented by the Visiting Nurse Associations of America. Before we begin our program, I would like to highlight a few housekeeping items. Today's program will include a period for learning activity and lecture and will be followed by a question and answer session. During the presentation, all participants will be in a listen-only mode. A live question and answer session will be conducted at the end of the webinar in order to allow the faculty ample lecture time to cover materials. As a reminder, today's call is being recorded Friday, September 6, 2013. Now I'd like to turn the call over to VNAA President and CEO Tracy Moorhead. Tracy, please go ahead.
Thank you very much, Eileen. Thank you all for joining us today. I am delighted that we are able to present an overview of this critically important issue for our nonprofit member agencies. I know that this deadline is sneaking up on some, and we have been receiving inquiries from some of our members here in the VNAA office for guidance and resources. We have an expert today joining us to provide that overview and some guidance on how you need to proceed. We're also grateful for our sponsors today, Castle Branch, and we have Gina Dillon and Mark Gorgeous from Castle Branch joining us. Castle Branch is a Wilmington, North Carolina corporation that, along with its subsidiaries, has been providing compliance solutions, including HIPAA and OSHA training and employment and student screening solutions to its clients for almost 2 decades. We really appreciate Castle Branch's support for this event, and you'll hear a bit from them at the end. Our expert today is someone for whom I have the highest regard and have had the opportunity over the last decade to work closely with on HIPAA and other compliance issues. Elisa Chesler is currently of counsel in the Washington, D.C. office of Baker Donelson, and she concentrates her practice in healthcare and insurance regulatory compliance, privacy, security, and record management issues, corporate transaction matters as well. Elisa joined Baker Donelson after a very distinguished career as in-house counsel and privacy officer to several large public and private companies in the healthcare space. Elisa counsels her clients on data privacy and security matters that arise from federal and state laws, including HIPAA, high-tech, state data breach laws, and payment card industry requirements. She assists her clients in identifying, evaluating, and managing risk associated with privacy and information security practices of companies and third parties. She also has a great deal of experience assisting companies in developing comprehensive privacy and security programs. Her experience with HIPAA and high-tech compliance includes preparing and negotiating business associate agreements, developing policies and procedures, and advising clients on data breaches and notification obligations. With that, I will welcome Elisa again and turn it over to you.
Thank you so much, Tracy, and thank you to all of the VNAA members who are attending today. This is quite the timely issue, and it's a pleasure to offer some assistance to you today. As you'll note, my contact information is on this first slide, and I hope that all of you will soon be following me on Twitter with all sorts of good little hopeful tidbits that you can get through there. As you may see from time to time, we have disclaimers in here as attorneys often do. One of the reasons I like to do this, especially with a HIPAA presentation, is that with HIPAA, when it first began 10 plus years ago, it seemed fairly simple. Well, what we've learned since then is the devil is in the details. And so that while today I'm going to be giving you some very broad general understanding and counsel as to where the omnibus changes have come, I want you to always understand that it is incumbent on you to make sure as you develop your compliance plans that you might identify where some of those special minefields are for you. The objectives for today is obviously we do have to start a little bit at the beginning because some of you may be a little bit more advanced, but some of you may still be at a little square one of understanding HIPAA. We're going to talk about the omnibus rule, which is really what brought us here today. The breach notification rule, because I think it's really important to address that. It is driving many of the changes. And hopefully some very good advice at the end that I give to my clients in terms of how to help manage your risk. So what is HIPAA? So HIPAA started as a part of the Health Insurance Portability and Accountability Act, and at the time, the Kennedy-Kassenbaum Act was really directed at providing individuals with credible coverage and other insurance like portability. But as a part of that, what they were also trying to do is provide administrative simplification to the process as a whole. And what that means is that the government had an interest in making sure that we had certain synergies and standard transactions that were coming within the industry. So no longer were providers such as yourselves tasked with having to give different information to different insurance companies. What this tried to do was provide these standard transactions and put them in an electronic form to create efficiencies. Well, what that meant, and frankly, Congress, I think, was very ahead of its time in realizing that as soon as we had all this information transmitted electronically, that there could be certain privacy and security concerns, and hence the development of the privacy and security aspects to HIPAA. So, of course, what is HIPAA concerned with? We're concerned with protected health information. And that can be in either oral, written, or electronic form. And the other thing that I probably could have underlined and bolded is the words past, present, or future. And the reason I want to pause on that today is if you are evaluating somebody as a potential future patient, that person is still covered by HIPAA as a part of your PHI that you would maintain. So again, there's all different parts to HIPAA, but the protected health information, of course, is at the core. And then who has to comply? So of course, those covered entities are the healthcare providers that submit those electronic transactions, such as payer claims or asking about eligibility. We also, of course, know that health plans are, as well as healthcare clearinghouses. Healthcare clearinghouses are those entities that you all might use to perform those electronic transactions on your behalf. So even if you don't, on your own premises, maintain that responsibility, if you utilize a billing entity or company to do that on your behalf, then you are indeed a covered entity and responsible for compliance with HIPAA. And then, of course, HIPAA realized that you would need and utilize all sorts of people who would not be employed as a part of a covered entity. So business associates are those entities that do something on behalf of the covered entities. And those business associates typically will create, receive, maintain, or transmit PHI. Fundamental to the HIPAA rules is that a business associate must sign a business associate agreement before receiving PHI. And those agreements, again, have existed since the inception of the HIPAA privacy rules. So what changed? In 2009, we had the HITECH Act. And among other things, there had been a huge development between when the rules were first issued around 2000 until 2009, when there were a series of very high-profile breaches, where it was very much realized that to date, OCR, the Office of Civil Rights, who's the enforcement agency for HIPAA, had largely been trying to get compliance by working with those entities that identified problems. But through those breaches, not much had happened, not much had changed in the industry, and not enough people, as far as OCR was concerned, were compliant. And certainly not enough people as far as Congress was concerned. So that is some of the impetus of the HITECH sections of the Act. And so the omnibus rules that were issued in this January were the natural reaction to that statutory HITECH Act in 2009. We are talking about making sure that we need to update and work with these changes. So again, going back to the fundamentals of the privacy rule. Privacy rule is concerned with how covered entities and their business associates use and disclose protected health information. Of course, you can use and disclose protected health information for treatment, payment, and healthcare operations without the authorization specifically written by the patient. That is what you do in your everyday work. In order to disclose any PHI to any business associate, you must have that BA agreement. And then, of course, is the individual rights section. This section, to a large degree, has been largely untouched in changes and has existed. But what's interesting for the most part is to date, we don't see many individuals utilizing their individual rights. There is some expectation that as these HIPAA rules continue to be enforced and enacted, we may see more activity here. Then the broad brush of the security rule is to make sure that your electronic systems that maintain PHI have the administrative, physical, and technical safeguards for that data. The administrative safeguards include making sure that every covered entity and business associate has performed a security risk analysis that documents all the potential threats and vulnerabilities to the protected health information that you maintain or have maintained on your behalf. That is a fundamental starting point of the security rule. And you will note later in my presentation that some of the more publicly breaches have centered around the failure to maintain this security risk analysis in documented form. Then, of course, you have those physical safeguards. Those include making sure that access to things like servers and any other computer maintained information is behind locked doors, that we are maintaining the security of that information. And technical is what most people think of. I'm sure you've heard a little bit about encryption and encrypting data. You want to make sure that those safeguards that you have, such as firewalls and antivirus software, are up to date. That's the very broad of the security rule. In 2009, with the HITECH Act, we also had, finally, a federal law with regard to breach notification requirements. Prior to that, we had seen since 2005, 46 states enact state data breach laws. Those state data breach laws, generally speaking, don't segregate themselves just to medical information, but they do focus on things like Social Security numbers and other sensitive information that would make an individual vulnerable to identity theft. For breach notification, it is incumbent on all covered entities to make sure that they have an understanding of what to do and what they would do in the case of a breach. For many states, such as California, the reporting timeline for the reporting of a breach is shorter than the 60 days that are offered by HIPAA. California, it's as short as 5 days for facilities. And in fact, at least one facility has been fined over $250,000 for failing to meet that 5-day turnaround. They had actually reported within 2 weeks. So you can see how strictly certain state regulators are also taking these issues. If a breach involves over 500 people, in addition to notifying the individual, the media is also required to be notified, as is Health and Human Services. If you have that breach over 500, The notification for Health and Human Services also is within that 60-day timeline. And then if it is for under 500, there is an annual report that is due no later than March 1st of each year to the government. One of the main things I think it's important for everyone to know is who is the privacy officer for their covered entity, and make sure that that is publicized so that your personnel are notifying you immediately of any potential breaches. Again, we have the omnibus rule now, and it modified and finalized those modifications from the HITECH Act. It also modified the breach notification rule, which we will go over. And finally, it also modified the Genetic Information and Non-Discrimination Act of 2008. There is more to come. There are several regulations currently pending in proposed form. One of those is additional guidance on how the minimum necessary rule is to be utilized. Another is the accounting of disclosures individual right. So I'm sure that we will all be speaking again in the coming years for more updates. So we know that the omnibus rule was publicized in January of this year. The final rule went into effect already. However, the government gave until September 23rd to come into compliance. That means to ensure that your business associate agreements are up to date, your notices of privacy practices are up to date with the changes. For any business associate agreements that have not been renewed or entered into since March, you do have another year to bring those business associate agreements up to date. Okay, sorry, I saw a pause. So what are the major changes? We're going to go over the breach notification change, as well as the fact that now business associates are also directly liable to the government for any issues or breaches that they have. We have required changes to the notice of privacy practices and restrictions. There are also changes to the marketing rules and how you can market. There is a requirement for the sale of PHI to get an authorization from the individual. There is also a need for fundraising opt-out procedures should you engage in any fundraising activities. Decedent disclosures are also covered by the rules, so individuals still have the right to have their information protected after they have passed away. We also have seen some changes in the enforcement rules, and again, you've seen changes in the way that HIPAA has been enforced, with more and more public corrective action plans, resolutions, and civil monetary penalties being provided by the government. Let's first talk about the breach notification rule. Previously, when the rule was issued in 2009, those breaches in which there was a concern that the breach compromised the security or privacy of PHI only meant if it posed a significant risk of harm to the financial, reputational, or other harm to the individual. So there was a risk of harm analysis the covered entities and business associates were able to perform prior to notifying individuals that a breach had occurred. So what's changed? Now there is a presumption that there is a breach. This significant risk of harm has been removed from the analysis. The analysis now does still include a risk of harm or a risk assessment, if you will. But instead of a significant risk, we are now looking at a low probability that the information has been compromised. There is some discussion as to whether or not this is a difficult or different hill to climb for covered entities when doing the analysis. And that is a very fact-based issue for your privacy security officers and legal counsel to work through. One of the more administrative tasks that everyone has been focused on for the last several months is to ensure that their business associate agreements are up to date. There have been some sample business associate agreements posted on the OCR website. However, they are very basic, and I would tell you that they're not very well drafted in protecting entities such as yourself. There are no extra protections required, such as requiring encryption, which currently is not explicitly required by the rule, but I would tell you is indeed the standard of care and very important for every entity to focus on and consider adding as a part of their overall compliance scheme. It is very difficult for any entity to argue that through their security risk analysis, they felt that encryption should not be addressed. One of the other things that isn't really addressed are agency issues. In the rules, there has been more and more focus on whether or not what we might term is a business associate is actually an agent under the common law of agency as defined by law. Well, what does that mean? It just means that there are vendors out there and business associates out there that the government might treat as one of your employees. This makes risk shifting very difficult. And if you have any concern that a vendor might be seen as your agent, I strongly suggest you address that with your counsel. Notice of Privacy Practices Amendments. One of the key functions of changing the rules was to ensure that, again, individuals have very good information about how each covered entity uses and discloses their protected health information. So, for the most part, we have seen additions for uses and disclosures of psychotherapy notes, if any are maintained. Certainly, if there's any chance that any of your activities is seen as marketing as defined by the rules, and of course those marketing rules were amended, so if you have not looked recently, you need to look again and make sure that any marketing that may be performed is outlined in your Notice of Privacy Practices. Fundraising, as we discussed, but I really want to focus on that last bullet point, and that is the one that I think each and every one of you must make sure is in your Notice of Privacy Practices. Some of you may have amended anticipating this change back in 2009 and 2010 as outlined by the HITECH rule, statute, and anticipating this rule. If your Notice of Privacy Practices must let patients know that they have the right to restrict disclosures of their information to any health plan if they pay for services in full. Here is the language of that section. Now, there is some question as to whether or not that is realistic for some of you, whether or not you've ever had anybody either A, ask for a restriction, or B, pay in full so that their health plan does not have access to their PHI. Regardless, you need to make sure your Notice of Privacy Practices includes a statement regarding this. It is also important for any compliance officer to make sure that your training is full, robust, and really focused on what your agency is doing. No longer are those off-the-shelf, very simplistic trainings looked upon favorably. I'm not saying to toss what you have. What I'm saying is there are ways to enhance and or make sure that that training is truly meeting the needs of your agency. You also need to know and should pay attention to certain states which also require some training and specify how often training must occur. Current practice may be that you train each of your employees at the time that they are hired, and then either on an annual or some other regular basis. Texas, as one of the states, has implemented a law in addition to requiring certain training time periods, that the training is documented and very specifically maintained. Make sure you are maintaining evidence that each employee is being trained. It is not only important for compliance, it has become very important at those times where we have identified when an individual may be impermissibly using or disclosing PHI. It is incredibly helpful to show the regulators that that person was certainly advised of their responsibilities. I've mentioned the Office of Civil Rights several times. That is the enforcement arm for HIPAA, and OCR has the power to investigate. OCR now also, as of the last few years, is doing affirmative audits, something that had not happened before. And through their affirmative audits of covered entities, they have developed an audit protocol. That is a good document for each of you to utilize to determine whether or not you think your compliance plan would pass muster with OCR. That document is available on the public OCR website. And again, I would encourage each of you to make yourselves familiar with the document. The HITECH Act also provided each state attorneys general with the ability to enforce HIPAA. We've seen several states, Massachusetts being one, being very active in this area. Previously, again, OCR did not have a lot of manpower to enforce HIPAA. So what you see now is not only the growth and number of OCR employees enforcing HIPAA, but each state attorney general is enforcing HIPAA and has been trained on HIPAA. Several states are also building a specific privacy office within the state attorney general arm of the government. California has one, Massachusetts has one, Maryland has one as well. The other thing is we are also seeing criminal action in the HIPAA world. The Department of Justice has the primary enforcement responsibility with criminal action. You may be aware that, of course, there have been fines issued more recently up to and including $1.5 million, but that is per violation. The largest violation to date is over $3.4 million, and several high-profile breaches have purposely been over $1.5 million to indicate to people the seriousness with which the government is taking these issues. You will see that there are now tiers and categories of penalties. And I would tell you that, again, in certain areas where they are seeing willful neglect, that is, ignoring rules such as the security risk analysis, that is going to be seen as willful neglect. And whether or not that is corrected with or within, or could be corrected within 30 days, is an important issue. This brings us, I wanted to cover certain high-profile settlements recently that entities have had with the government. One of the most significant, I think, is the Phoenix Cardiac Care settlement. What you have there is 3 physicians in a fairly what might be seen as small practice. We are not talking about a very large practice. They had developed an online scheduling system, and they were also found to be using personal email accounts. The issue with the online scheduling system was that patients could see each other's names when they were scheduling their appointments. Not a very bright thing to do. When the government came in to investigate, again, in addition to finding the personal email use, the Yahoo accounts, they also found that there was not adequate policies and procedures, they had not completed their security risk analysis, and there really was no training. Well, you'll see a $100,000 fine there. What you don't see is probably a very significant amount of costs associated with rectifying this and negotiating the settlement. I also want to point out that, again, this may or may not seem low to you when compared to the one below, which is $1.7 million, but it should indicate, again, based on their size, where they're going, and the fact that this is a starting point. I'm not sure that the same practice would be getting the same treatment today, and certainly not in 5 years from now. I found the Alaska DHHS settlement interesting because what you have there is the government going after another arm of the government. This is the Medicaid department. A USB hard drive, which of course those little thumb drives are certainly small and easy to lose, had gone missing. Again, the failure to have adequate policies and no completion of a security risk analysis paid into that $1.7 million fine. Blue Cross Blue Shield of Tennessee was one of the first fines after the enactment of the HITECH Act. It involved 57 unencrypted computer hard drives that had been maintained, had either been stolen or missing from a leased facility. It cost Blue Cross Blue Shield of Tennessee over $19 million to remediate that issue. That included trying to recreate the information that was on those 57 hard drives and contacting and notifying each of those individuals that their information had been compromised. But the one that I think should be the most interest of all of you is the Hospice of Northern Idaho. That $50,000 settlement was within the last year, and it was the first settlement that involved fewer than 500 patients. It involved the theft of an unencrypted laptop that essentially had information on all their patients. This small nonprofit entity had not conducted a risk analysis and did not have the policies and procedures to address mobile devices. So again, for those of you who feel fairly comfortable that you do have both privacy and security policies and procedures, again, I would ask you to make sure that those are robust enough to take into account the mobileness with which your visiting nurses may have and the kinds of PHI they may be carrying with them on a day-to-day basis. I wanted to also give you what I like to call the baker's dozen. These are some of the helpful hints that I try to identify for my clients at the time that we first start to engage in updating any sort of compliance program. First, if I haven't said it enough, I'm going to say it yet again. you need to make sure you have a security risk analysis documented. If it was done more than 2 years ago, I would certainly revisit it again because so much has changed within the last 3 years. One of the issues I brought up earlier was in the way that encryption is now viewed as really what I would argue is a standard of care. I would also tell you that your prior security risk analysis may not have paid attention to things like antivirus software and firewalls with the specificity that they probably should now. The reason I also highlight those two is that two of the more recent settlement agreements with the government, one of them being WellPoint, involved the failure to put firewalls back up after a software change was made to the system. So as a part of your security risk analysis, I would also ask you to revisit any change management process your IT people have when they are performing any sort of maintenance or upgrades on your system. Business associate agreements. Again, obviously, hopefully each of you has already began to undertake to update your business associate agreement for ensuring that your business associates are also complying with HIPAA in the way that is anticipated, that you are trying to also consider not just your regulatory obligations, but risk management for your entities as well. Do your business associates maintain the right insurance should a breach occur? Or will they just go out of business and leave you holding the bag? Are you indemnified to make sure that they will stand behind the work that they do, again, should an issue occur? What I also see is where business associate agreements swap the parties. Many times I see covered entities such as each of you incorrectly utilize a form that was created for a vendor. Like any other negotiation, there are terms that are more favorable to one party than another. Whereas your standard may contain a clause that requires insurance, theirs will not. Well, your standard may require them to respond to you and notify you of a breach within a short period of time to ensure you're meeting any sort of state law requirements. Their standard will not. So make sure that your business associate agreement is not just one of those off-the-shelf ones, but also one of those off-the-shelf ones that was meant to help a business associate have as much broad control as they would want. Trap number 3. I see a lot where because of resources, when a standard agreement is put in front of my client covered entities by what would be a large vendor, it is just executed without, again, any thought to any particular needs that you may have with regard to state law, any indemnification you would want, and making sure that they are truly helping you to stay and be compliant. Earlier today, I mentioned the issues with agency. You can be fined, while business associates can be now fined directly, you are responsible for those acts of your agents. One of the best ways to identify and make sure that you do have business associate agreements in place for all of those vendors that you need to have them with is to pull out your 1099 records and see who you have paid and determine whether or not, because of the work that they do, they would have any access to your PHI. As I mentioned previously, compliance with individual rights has been a focus of the specific $3.4 million enforcement action. That action was because a clinic was failing to provide individuals with their basic access right. So again, while a patient may or may not, when asking for a copy of their record, specify HIPAA, you should know that HIPAA should be in the back of your mind. Sorry, it went backwards. Oh, there we go. They really see this as a fundamental obligation of each and every covered entity. Again, as I mentioned, 46 states currently have a breach notification law in place already. There are also a variety of other protectionary laws focused on certain areas. You're probably familiar that most, if not all, states have specific laws with regard to HIV, mental health and substance abuse, and mental health and behavioral health records. Those state laws add a layer of complexity to your HIPAA compliance program, and I would certainly encourage you to make sure that your HIPAA policies take those issues into account. We see also a lot of the state law issues occurring when we also are helping clients to respond to subpoenas. So make sure that any times that you're getting any sort of legal document that you're considering both HIPAA and the state law. Data incident policies. Because there are more and more breaches being identified and found, and because there are so many different issues associated with it, I strongly advise each and every one of you to make sure that you have a data incident policy. You will have enough to do at the time an incident is identified. Then try to reproduce what you should be doing, who you should be notifying. You should know your local law enforcement that you should be contacting, whether it is local or state or the FBI. You should have those phone numbers handy. You should know the states in which you want to have a contact with an explicit regulator, typically in the State Attorney General's office. IT is a good source of getting your security rule requirements met. Make sure that if you purchase a security rule manual for HIPAA compliance, that they do not conflict with any IT policies and procedures that your IT department maintains. Again, as I mentioned, there's audits going on. There's also due diligence going on, where prior to choosing a vendor, you may want to consider and make sure that you know or feel confident that they are HIPAA compliant. Again, once you have a business associate, they make you vulnerable. I've discussed encryption. If any of you, I don't know that any of you would be, but any stage 2 issues, those enhance the need for encryption. Change management, again, I had discussed that earlier. Want to make sure that your IT department realizes that HIPAA is implicated when they're doing their jobs on a daily basis. Human error. I will tell you that over 90% of breaches that occur today are due to human error. You are only as strong as your weakest link, and people do make mistakes. Again, you want to train them to have the diligence with which you would expect, and make sure that your training is meaningful and addressing those things that might happen while they are out performing their duties as a visiting nurse. One of the other things that people do not think of is how you are covering your own employees. It's helpful to know that any self-insured health benefits program that you may be sponsoring for the benefit of your employees is also considered to be a HIPAA-covered entity. This is something that you should bring up with your HR department to make sure that they are aware of their responsibilities in this area. And finally, I've mentioned insurance. It is important that each of you consider getting insurance to protect yourselves should a breach occur. There are some figures out there that estimate that the cost of a breach is somewhere between $200 and $300 per person for each breach for just the hard costs, that being the notification to the individuals, the provision of credit monitoring to those individuals, and the notification to the government. That wouldn't include certain things like legal fees, class action litigation that we're seeing a lot of, and other things that come with the forensic investigation that might need to take place. So I've gone very quickly and wanted to leave some time for some questions. But before that, I would like to turn this over to my good friends at Castlebridge.
Thank you so much, Ms. Chesler. At this time, we'll hear a brief message from Gina Dillon and Mark Gorges, who are representing today's webinar sponsor, Castle Branch.
Hello.
Hi, Gina.
Hi, this is Gina Dillon with Castle Branch. I just want to start off by thanking VNAA for letting us be the sponsor for this educational webinar. Just to give all of you some information about Castle Branch, we are a leader in innovative workplace and employment screening solutions, and we offer HIPAA and OSHA compliance courses through our e-learning center. Our e-learning center contains a library of online courses for self-paced, interactive learning for all of your employees, including over 60 role-based courses for covered entities, as well as 3 level-based courses for business associates. Our library of courses have been written by nationally recognized experts and reviewed by a leading healthcare law firm. Our courses provide key concepts which are presented multiple times in a variety of ways to improve comprehension. It includes virtual bookmarks and notes to continue at a later time if needed so that your employees can complete this at their workstations. And then the employees receive certificates of completion once the course has been passed. And through our e-learning system, you and your employees will receive a certificate of completion, training renewal alerts, and secured online document storage of all of the course completions. And we did, with our relationship with VNAA, we have negotiated a discounted rate of $15 per employee for all of our online testing and certificate management.
Thank you so much, Gina. At this time, we will move into the question and answer session of today's call. And if you would please state your name and agency when you're asking a question, and I will go ahead and start the Q&A. While we're waiting for participants to add into the queue, 2 questions were chatted into me, Ms. Chesler, for you. And the first is the covered entity accountable for security of PHI at the business associate?
That's a very good question. And in a typical lawyer fashion, I'd probably say, well, yes and no. So what are you responsible for? You are responsible to some degree for ensuring the due diligence with which you look at that business associate and trying to make sure that you have chosen somebody that does the job appropriately. With that said, as I mentioned earlier, business associates are now directly liable as well to the government for their acts and or omissions. So ultimately, if one of your business associates were to have a breach, what I think we would see is an analysis done by the government to determine, 1, were they really your agent? Were they really acting in their capacity as your agent, which is a very difficult analysis to do. The other thing that they will likely take into account is the size of that business associate. For example, if you utilize a cloud computing service to maintain your PHI, and that cloud computing service were to have a breach, I think they would look at that very differently than if the breach were from one of your smaller consultants, like, say, a smaller billing agency or accounting firm. So, unfortunately, there is no bright line, but yes, you do have some accountability for your business associates. Hence, you should be very cognizant of what your agreements say and whether or not you feel that they are able to comply.
Alrighty, thank you very much. And we'll open up the lines for the next question. Hi there.
Yes, the next question is which BAAs are grandfathered,
Okay.
and when do they need to replace with new agreements?
Yes, let me be very clear on that. So, if you have a business associate agreement that has been in place for however long and was entered into prior to March of this year, then you have until 2014. That is considered one that is grandfathered. Anything that has been entered into or renewed since March of this year needs to be updated within the next 2 to 3 weeks. So again, you have old agreements that have been in force for years, or again, at any point prior to March, you have more time to update those.
When is that in 2014 that they need to be updated by?
Oh, it's September 23rd, 2014.
Thank you.
Sure.
Thank you so much. I'll now open the line for the next question.
This is Kathleen Peterson at VNAA in Kansas City. And regarding the Patient Privacy Act, we know we need to send that out to all of our patients. The question is, do we need to have it signed back by the patient, or just that we provide the notification to them?
So the notice rule generally encourages and asks you to obtain the patient's signature. And because your nurses are interacting with them probably typically face-to-face, I would encourage you to have a process that does get that signature. However, if you're not able to obtain that signature, you can have a process which essentially documents in the way that it was provided. You should have a policy and procedure that does indicate what you're doing and how you're doing it. And that is probably among the most important piece, is to just follow what your procedure outlines.
Thank you.
You're welcome. I see also a question that's come across, which essentially asks that PHI is any information tied to a patient's health that identifies a patient in any way. So does this mean that PHI includes more than just diagnosis? So saying John Smith has shortness of breath would be considered sharing PHI? Yes, that would be PHI. Diagnosis is not just the only part to the PHI. It's the identification, frankly, even just that that person has ever been seen or might be seen by you. It could be the patient's name and address with your agency's name at the time. So a list, if your nurses are traveling with a list of patients and the patient's name is the only thing on there with your logo at the top, that is PHI. No actual health information has to be on it to be considered PHI. Tying an individual to a provider is PHI.
All right, thank you. We have one more question in the audio. I'll go ahead and open that line.
Yes, hi. This is Porchlight VNA, and back in '74, I believe it was, Medicare required us to, put out our notice of privacy practice, and there's a whole Medicare form specific to that, that the Statement of Patient Privacy Rights, la 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 la. So I'm just wondering, in my patient handbook, do I still need to include the Medicare Medicaid notice, approved notice, plus a different notice of privacy practices?
I have to admit, I don't know firmly, but it is my belief the answer is yes.
Okay.
I believe so. I would ask you to double check with your legal counsel, but my belief is that yes, indeed, you need to have both.
Okay.
I'd also like to note there was a really good question that was also just asked that I would like to address. And the inquiry was, does a password protection count as encryption? The answer is no. It is not. Do not be just using password protection as encryption. They are different things.
So we have one more question.
Sure.
We do patient profiles, and we get permission from the patients, and it does disclose, and they're aware that we've taken them on because of CHF, and this is their doctor, and blah, 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 blah. And we give those to, referring doctors to say, look at how good they think we are. Is just receiving a patient permission, them signing off on it, enough, or do we need to do more?
I'm sorry, can you ask the question again? I'm not positive I'm following the question.
Okay. We create patient profiles as part of marketing, and we get the patient's agreement ahead of time, and then they sign off and say, yes, I agree that you can create this profile. And we tell them what's going to be included in it, which might be their diagnosis and why we saw the patient because of heart failure, and this followed by this doctor, and then we use those as a marketing tool. Do we need to get more than a patient sign-off?
Yes. Yes, please consult your legal counsel. You need more than just a patient sign-off. I mean, there is a release that really needs to be used, a specific legal release that will have much more. I would suspect much more than I agree to let my name and information be used for your marketing.
Okay. Thank you.
Sure.
All right, thank you so much for the questions. And if there are no other questions this morning, we would like to take the time to thank you all for joining us today. The slides used in today's webinar will be distributed with the recording to all registered participants and their guests. I would also like to thank our guest faculty, Elisa Chesler, for her expertise, time, and commitment to making this a successful program. I hope you all have a wonderful afternoon and a happy weekend, and thank you again.